Let's move on to idiopathic pulmonary fibrosis. This is defined or characterized as a chronic and progressive disorder that may be fatal. It's characterized by progressive scar formation with no apparent etiology or precipitating factor. It tends to have a characteristic pattern on high-resolution CT of the chest, although you can have IPF with somewhat atypical appearing CT patterns. But the CT is the pivotal study that determines the diagnostic algorithm for these patients, and in the appropriate clinical context, if you have a UIP pattern, this might be enough to make the diagnosis. An important point, though, is if you have an inconsistent UIP pattern, some of those patients, especially elderly patients, might still turn out to have IPF. Now, we talk about this term UIP. It was initially a pathologic description, usual interstitial pneumonia, and then this kind of crept its way into the radiographic lexicon nomenclature, where we talk about a CT UIP pattern, and then you also have a pathologic UIP pattern. Clinically, patients with IPF present with shortness of breath, typically over the course of many months, and sometimes this is associated with a hacking dry cough. In some cases, maybe 10 to 15% of cases, patients present with cough alone before the onset of shortness of breath. If you think about IPF and how common it is, it's not very common in relation to other more common causes of shortness of breath. So a lot of times patients will go misdiagnosed. They might be diagnosed as asthma, COPD, heart failure, very common in the elderly as well. So it is very important to be aware of this condition and to be on the lookout for things that distinguish IPF from these other more common entities that might present with the same features. One of the typical findings on chest exam that might alert a clinician to the presence of IPF are the distinctive inspiratory Velcro crackles that are typically heard at the bases. IPF is a disease that carries with it significant potential mortality, with the median survival estimated at anywhere from around 3 to 5 years. As depicted in this slide, it is a disease of the elderly. The older the patient, the more likely it is that whatever ails them in terms of interstitial lung disease is going to turn out to be IPF. Even though it is a relatively rare condition, it accounts for about 1/3 of all lung transplants that are performed nationwide. This slide shows that the prevalence of IPF is actually increasing. This study was taken from a large Medicare database, and this alerts us to the fact that we are seeing more and will continue to see more IPF in the future. As mentioned, the prognosis tends to be quite poor. From this particular study, the number of patients surviving to 5 years was around just under 40%. If you look at this in the context of cancers, IPF has a worse prognosis than most or many different forms of cancer. The only cancers that have a worse prognosis than IPF are stage 3 and stage 4 lung cancer and pancreatic cancer. It is important to make the distinction of IPF versus other forms of interstitial lung disease, because what we tell patients in terms of prognosis is quite different. For example, IPF has a significantly worse prognosis than patients with an underlying connective tissue disease. Hence the reason to make an accurate diagnosis, because it has prognostic implications and, as you'll hear, also has treatment implications as well.